I'm Michael St. Jean, and I'm one of the general surgeons here at Door County Medical Center. It was actually probably my first day of my first medical school general surgery rotation. I can remember it like it was yesterday. I was at Walter Reed Army Medical Center in Washington, D.C., and I wound up scrubbing for a very complicated pancreatic cancer case that lasted about 13 hours. At the end of that, being fairly physically exhausted, I remember talking to my wife on the phone and saying, I figured out what I want to do. I was a late bloomer to robotic surgery. I was one of the original naysayers, at least in my opinion, and I had a former partner who was one of the preeminent bariatric surgeons in robotics in the country, and she urged me to at least try. And as the saying goes, I took a sip of the Kool-Aid and I was sold from there. And so for the last 6+ years, I've been performing almost all my surgeries robotically. The thing that I would like patients to know most about me is that I'm as approachable as anybody can be, and that oftentimes I think patients are apprehensive about asking questions. And I'm always fond of telling patients, you can come in with as many questions as you want. We're going to answer all of them regardless of how long it takes. Sometimes that leads to me being a little long-winded and my appointments run over a little bit, but I always tell people you're going to get your money's worth because we're going to spend time together, and there's not going to be any doubt in your mind that I haven't explained everything as adequately or as if, to the nth degree. I would say, a good day at work is, it may be just one out of several, but one really good patient interaction where I feel like I've impacted that patient's care, whether it's doing surgery, preferably, but sometimes just, educating a patient. When I was in the military, I was involved with graduate medical education, teaching surgical residents, and one of the things I used to always tell residents in their training was that the art of surgery isn't about doing surgery. The real art of surgery is knowing when and when not to perform surgery. And not everybody needs to have surgery, and sometimes I think when you present that to a patient, they understand, or they have an appreciation for the fact that you're being forthright with them. And lots of times, that puts them at a sense of ease, and they can make more informed decisions that way.